Worldwide, there's about 18 million deaths that occur every year from cardiovascular disease, and this may be things from heart attacks and strokes. And two leading risk factors for cardiovascular disease can include high blood pressure, which is hypertension, and diabetes. And according to the CDC, almost half of U.S. population has high blood pressure, hypertension. 11% have diabetes, and 38% have prediabetes. So you can see there are a significant number of people in the United States that are at our risk for cardiovascular disease. Now, fortunately, many of these patients are being treated successfully with medications and diet and living better quality life and longer life. In this video, I will reveal another additional non-invasive treatment that we can add to these patients' usual medical care that can increase their longevity, reducing their risk of death, and also improving their quality of life. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. In a recent meta-analysis of almost 250 randomized controlled trials, these are very good studies, that looked at over 21,000 people. And these were patients that had either high blood pressure, diabetes, or cardiovascular disease. And what they did is they wanted to compare those people who were just getting their typical medical care, things like medication and diet, and compare them to those people who were getting that usual medical care plus added exercise to their routine. Throughout these studies, the major type of exercise reported was aerobic exercise, but many studies also had a combination of aerobic and resistance exercise. And these exercise routines were typically implemented for just a 3-month period, and patients often followed for just 6 months. And amazingly, with even just 3 months of an exercise routine, they were able to see a reduction of death, all-cause mortality, by 18%. And they also found a 20% reduction in the risk of some serious adverse medical event. So by adding exercise on top of usual medical care, we see significant improvements in reducing death and reducing the risk of some adverse medical event. Let's wrap up this video and go over a few key points. Number one, does adding exercise to usual medical care reduce the risk of mortality? And the answer is yes. Even if you're taking medications for diabetes or high blood pressure, adding exercise to that regimen will reduce your risk of death and will also increase your quality of life by reducing adverse medical events along the way. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.